If my children don't eat candy or drink soda, why do they keep getting cavities? That's a question that a lot of our patients ask when we're just kind of dumbfounded as to why they get cavities. The most obvious sources are candy and soda, so we know if we want to avoid cavities to keep those out of our daily diets. There's some less obvious things that kids consume that can contain carbohydrates. So when the bacteria use carbohydrates for food, they turn those carbohydrates into acid, and that acid is what dissolves the teeth and forms a cavity. So when we think about carbohydrates, that's anything with sugar in it. So glucose, fructose, sucrose, lactose, anything that ends in ose is a sugar. So something that a lot of people don't think of is crackers. So crackers are just mostly made of flour. Flour is just made up of a bunch of glucose molecules. So that starch breaks down and is pretty much just sugar right on the teeth, and crackers can get stuck in between the teeth really easily compared to a lot of other foods. They're there for a little bit if we don't get them out afterwards. Some of the other sources we see are juice. So juice can be a really easy source of vitamin C. Kids love to drink it, easy source of energy for them. But really what we found is that according to the amount of vitamin C that a child needs, they really only need about a half a cup of juice per day. So that's really only 4 ounces. It's a really small amount. And anything more than that, pretty much just sugar water. So they don't need the extra vitamin C and they're not going to benefit from it. So when your kid does eat juice, drink juice, they should have it with a meal ideally, and then not have it in between meals. So snacking can be one of the main causes of cavities. So we try to search for things, what are they having in between meals that causes cavities? For cleaning in between the teeth, of course, you always hear about us talking about flossing. The main thing that can happen with in between cavities is that the plaque just is allowed to sit there, and so that can be an easy way to prevent cavities in between the teeth. With baby teeth, as long as they're not touching another tooth, if there's nice spaces in between them, you actually don't have to floss there, and we can wait until the grown-up teeth come in to start that habit. But some baby teeth are really tight together right up against each other. So in that case, it's best to floss daily. And we know, especially with real young kids, I know that's easier said than done, but we just do our best.